and Well-being, Part 2. Our speaker, Mr. Pankaj Jain, who's a master practitioner, Meditation and Sujog Acupuncture Therapy founder, and Origin Smile Foundation. So, what we are going to look about today's session is going to be solutions for mental health challenges and introduction to smile meditation and its healing tools. Now, this today is being done in association with the NISA, DCBA, NCBA, and Triple FAI. So, without wasting too much time, I'm going to pass on the stage to Dr. Pankaj Jain, who will take the second session forward. Dr. Jain, all yours. Please go ahead.
Thank you very much, and smile afternoon to all of you. So, part 2 of actually introducing not the suffering. Actually, our basic spirit at last it's to introduce you about smile. Actually, smile here signifies a state of harmony, a state of enlight, a state of awakening, a human mind state into such a evolved state. In that higher neutral state, it's a human possibility that he can transform his sufferings, and especially here we are more concerned in this session to introduce about the mental health sufferings, but actually as a whole, body, mind, every level sufferings, by a higher smile state which has a capacity to harmonize and transform your beds in the life as well as too good into the life also. Just underline, I say even not only bad suffers in our life, even good, too good, expecting too good also suffers us. So finally our purpose is not the suffering. Finally our purpose is to remain in harmony in the bad times also and even in the good times. So is possible, and that is what we are going to realize, that we have a possibility through the smile states. So this introduction about our mental health initiative is at last is with the essence that how you can transform your good life to smile life, your good mornings to smile morning, and even your today good afternoon to smile afternoon. Okay, so thank you again for being here with me and continuing this journey together. So before we go to part 2 again, we'll have a short recap, because part 2 is now we are going to just have a light on the pathways to heal, which is already proven in this society in a scientific manner. So before we talk about this, let's shortly recap, okay, what we have realized in the part 1. So we introduced shortly what is mental health. In general, mental health, we say whenever our feels, whenever our thoughts, and whenever finally behavior, when they really started affecting our personal life, family life, and social life. First of all, they all are interrelated. And in the whole life, we have to live with all this simultaneously. We as a human being, if we have a mind, we will, to exist to the mind, existence of mind needs feel. we say more related to the emotions. We have to think. Thought is also part of our breed of this mind. It has to think. That is his job. His job is not like body. His job is role is different. So mind role has to do his mind role. So feeling, thinking, and finally at last we say behaving. And finally we live with the help of this mind, our personal life, all the routines from morning to night, our job lives, we live family life, and also parallelly we are living the public life. Only when we started suffering with this beautiful integrated system which is already being given by the creator system, when we are not utilizing these beautiful correlations into harmony, it's the problem is not from the outsource. First, basically what we are going to realize is our misunderstanding, our unawareness is the first root cause of the sufferings. So just this days of 2 sessions, we are just trying to first get aware first, minimum basic awareness about what is mental health issues really. What are the early signs which we are commonly finding people are missing? But when I say missing, both the way missing, sometimes underdiagnosis, sometimes overdiagnosis also. Then we say moderate, and even we have a severities. So commonly when the peoples are getting moderate mental health issues or severe, commonly we can easily recognize them. They can also recognize something is really wrong. And even the family members or nearby peoples can recognize. But sometimes very early signs, sometimes we miss. And if we miss, not properly handled, then it multiplies even to moderate and severe. Nothing goes directly to severe. So this is what we just shortly touched down. So so the first important point is acknowledge the problem, recognizing the changes, something, thoughts, emotion. Last time we just talked about very common, mild, regular symptoms of, we say, mental health, like stress, like agonies, like fears, okay, which is in our routine life, overthinking. So whether this has to be considered as a part to be concerned or not concerned. Even right now, being you are not a non-medico, you are a non-medico, sometimes better not to get diagnosed yourself. Better with the help of some specialist, get it at least aware, or at least have the information, or at least diagnosis whether this is really to be concerned or it is natural. Last time I just gave one example for you about blood pressure. We all have blood pressure, which is existential. When it is above normal, yes, it is to be concerned. But when it is below normal, to be concerned. But when it is in optimal level, it is required. Blood pressure is required. Only when we human has to intervene through the help of the doctors, or even if he's trying with some self-help systems. Intervention is required commonly when something is in disharmony. So we cannot remove the BP. BP is required. We need harmony BP. Similarly, temperature, everything. So is our stress. So is our fears. So is our all the emotions and thinkings, means whatever the thoughts, thinking, everything is required to live this life. Only thing is whether they are in the optimal limit or not. So just first, even if you have some doubt, better recognize and acknowledge it. Talk and share, at least with some near dear, at least to get it sure whether this is, without being judgmental first. And for that purpose, better you have a specialist to check first. And from there, first, we have to distinguish clearly from our diagnosis to misdiagnosis first. This is very important. Okay. Because wrong diagnosis itself needs things, get it more things in a worse state. Okay. Because understanding is the first strength. It's not a weakness. And commonly, because of all the stigmas, people are not willing to talk to this because of the public and lot many stigmas. And then, with the help of your consulting doctors, okay, just to first understand, is it mild or moderate? Worry, fear, sleep, difficulty focusing, lots of interest. Though in the part one, you can check, we have talked much in detail. Okay. Suicidal thoughts from the severe conditions or actions, hallucinations. These are imagining something, but realizing it is a reality. And then suffering because of this. And because of all this and extreme mood swings. Okay. And daily routine life is disturbed. Whenever all these thinkings, emotions are not making you to live into the present, able to focus in your present life, shortly is fine, occasionally is fine. But if it is becoming a regular routine, yes, we have to get concerned about it. So shortly, okay, this is the common and mild mental disorders on your left side. Okay, like stress, burnout, anxiety disorders. In a whole day, sometimes we all have little bit fluctuation in a day, which is within optimal limit. But sometimes when it becomes your regular behavior, then yes, we have to be concerned. And on your right side, you can see something really getting more worse. So we have just make a general outline about the severe mental disorders. Okay. So and even this common mild mental disorders, commonly they leads to the psychosomatic, means body having reflection in a routine life. As I explained you, okay, some daily stress, and then your neck is pain, your head is pain, your acidity is there, and it becomes fuller features and loss of sleep, and then some mild anxieties and palpitations and lot. These are become a regular issues. Even it is still sometime in a common side and milder form, and may go to moderate. Okay, but sometimes we can see the delusions and obsessive compulsive disorders. These are the which make now getting to the chronic side. So with the help, okay, so first it to be get diagnosed. Right now, my here concern is today to add some more understanding for you, because all this number of times, whatever the physical issues you are suffering in a routine time, your doctor says it is coming from your psychological point. Number of people complains, oh, I have a chest issue, I have always have some discomfort in the chest. First duty is to go to the medical doctor and to check it, at least beginning side once. But when you go with a severe pain, sometimes ECG done, if everything is ruled out by cardiologist, nothing wrong, but they say, but you still say, doctor, why I'm suffering? Then they sometimes they say, oh, maybe it is acidity. So sometimes acidity is reflecting as like this somatic issue. But now what is the root cause of the acidity? Then again, it is coming from the psychology. So then they start thinking, doctor also advise you, okay, you take this, some mild sleeping anti-anxiety drugs. So somewhere they are already trying to indicate you that this physical somatic body symptoms, which is a recurrent feature for you, is not from your body origin. It is coming from your mind origin. So that is what we say as a mind-body diseases. So here there are actually hundreds of diseases or discomfort or symptoms which is common into the society, but few of them I have just marked it with the red arrow, you can check. And this is all proven things. Number of times 80 to 90% cases of these cases we find, we treat, we support them, they support themselves on the mind level, they are better here, sometimes cure also. So like migraines, headache, sort of headache, okay, fibromyalgia, it's all muscular pains, okay, seizures, even epileptic attack. Not always there is a brain pathology by looking to the EEG. The neurologist also says then, oh, there is nothing significant findings with all the investigation. So we say functional. Functional means something not being find something wrong on the body. So there has to be something. And we as a human being are not body. We have something wonderful like a mind, and even we have something like beyond as spirit and souls. Anyway, persistent postural dizziness. Sometime when you go down and you pick something, every time when you routine work, you feel some giddy for a moment. So this is also what we have say PPPD. Okay, even tremors. Commonly we say tremors is old age. Okay, first of all, old age is not a disease. Don't make old age, which is just a beautiful creation system of the body. It's a natural cycle. Everyone has to come, but every old person don't suffer. Don't suffer. Okay, so we cannot say it is a primary cause. So tremors are commonly seen during any anxiety times, long-term mind imbalancing, and then something it replaces. Okay, so few of them to note it down here. Okay, so even this is in the neurological pain, and even Alzheimer's I have not noted here. Okay, Parkinson, there is lot many things. Few of them which is common. I'm just okay, like in respiratory systems, asthma, very common, allergic asthma. You're sensitive to this, but why you're sensitive? 10 years before you're not sensitive. Now from 10 years you are sensitive. So there has something wrong. Even respiratory doctor says it is allergic. But why the dust? Allergy now. Dust is everywhere. It is a part of your existence. You cannot make a dust-free world ever in this real world. To be in the real time, we have to understand. Yes, if there is a really something factor which is real factors, you have to avoid an asthma. But not every time this is the truth. So that another half which is missing in aware awareness, that sometimes this is coming from the psychosomatic origin. So number of asthmas get worse with small anxiety, stresses, even mild and moderate phenomena also. Blood pressure itself. When we are understanding, when I am learning the medical books, even right now in our medical books, it is still written today that blood pressure, diabetes, we say idiopathic or essential. What do you mean by essential? When the cause is not known medically, we say essential. 80% of the peoples worldwide right now, they are suffering with essential hypertension. So there has to be some root behind body diagnosis. So commonly now, psychosomatic relationships are strongly developed. And as I say, number 21 is non-cardiac chest pain. Number of people, oh, my arm is paining, this paining. Seems like every time they have this, no problem. You should go to doctor to recheck 10 times. But sometimes doctor says, no, it is not actually the cardiac issue anymore. So sometimes psychosomatic is the deep cause here. Okay, so functional palpitation, okay, dyspnea, okay, breathlessness, okay. So few of them to note down. Now let's come to the gastro part. Irritable bowel syndrome. When your large intestine also become irritated, okay, become angry. So large intestine also has a local mind. So when become irritated, whenever someone eat, he has to go immediately for the motion. Eat some motion. Even the routine foods, digestive system is not able to take it. Okay, functional heartburns. Okay, what we say commonly in the acidity terms, and sometimes and peptic ulcer, especially duodenum ulcer, is very well known already. Functional constipations. Whenever there is a word functional, remember the term functional means it's non-pathological. Nothing being diagnosed on the body, then we say functional. This is a general category. We say functional, which is coming from the body beyond, that is mind and other dimensions. Like type 2 diabetes, as I say. Okay. So few of them to note down. Similarly, on the urinary symptoms, few of them. Okay. Number of people who are suffering with the erectile dysfunctions. Okay. Libido issues. In the females, premenstrual symptoms, irritability before menses, during menses, after menses. Okay. Even there is a psychogenic infertility is also being noted on. Okay. Now, one of the more common is sleep disorders. Okay. Starting from the primary insomnia. Last time I very clearly categorically told you that sleep is a food for body. As like breathe, it is like a food. As like you take food, sleep is body need, existential need. So this is also affected. So that's why it is a psychosomatic disorder. Whenever your sleep is disturbing, it's a sign. It's not a matter of body being mind being affected. Mind may be the culprit, making your body into disharmony. One of the sign is sleep disorder, and this is a very very early signs. Early signs. So if your sleep is getting disturbed, it's a sign your body is also under now issues. Okay. So night tremors. Okay, sorry. It is changing. Sorry, night tremors and so on. Next. Even the skins, dermatology part, eczema, psoriasis. I'm going a little bit faster just to make you understand and indicate only that sometimes we are thinking it is a body issue, but actually there is coming from the psycho origin, mind origin, urticarias, tinnitus, some extra sounds. Okay. Number of people during the COVID times not only suffers physically with the corona and its infection, every person immunity was different responding into the same family members with the same amount of exposure. We say immunity, and immunity is just, we are only relating with the body capacity to handle any infection around. But here we are talking about the mind capacities also. So if someone was very strongly, willingly, he was very mindly also stable, their immune system was also better to respond bodily. So even long COVID, some people suffer symptoms both because of their stresses, lifestyle into the past. Number of time you have seen in the COVID time, people fear becomes an additional factor to make the things more worse or even to maintain some later on effects that we say as long COVIDs. Okay. So after being in general getting the diagnosis with the help of proper healers, doctors, okay. So if what is the reach out for the help now? Okay. So if there is a mild and moderate, the first thing that we should start talking. Talking itself is a healing to the trusted friend, at least sharing. Sometimes number of our small relationship issues is only why because we are not communicating. Not only stigma, maybe we have some relationship conflicts within us, personal egos, lot many things are there. In the mild and moderate forms, even the self-care strategies like meditation, mindfulness, and all this lifestyles, this part I'm just going to focus this time a little bit more about the beautiful solution in your early states, even moderate. And with the help of the medical doctor supports, other medicine if required, or their support, along with that also you can parallelly add on. Or to consult a therapist or a counselor, which is from this field. But if this is a severe issue, then no doubt you have to take a mental health professional like psychiatrist, clinical psychologist, and if required, medication is also required, but not in mild forms or moderate, but surely moderate onwards, there is a requirement to come. So support it. And if there is suicidal thoughts, one has to be really concerned and take it as a okay. So most important here is a final notice. It's not to self-diagnose or ignore your symptoms. And early help can change and things in a better transformation. Okay. So it is just a general understanding for you, because sometimes peoples are commonly concerned nowadays. People don't want to take the medication. Okay. So I'm just giving a general impression till at this moment of time, whatever the research is we have, that first of all, as I say, it is almost getting a pandemic, starting from the mild to the severe states available. So 1 in 8 people are globally live in a mental health disorder. Out of 8 people's, 1. And only a portion of require medication. 30 to 50% of people will may require medication as a part of their treatment. Rest 70 to 50%, we have still better to possibility on the self-care possibilities. Okay. And medication is really crucial when someone is suffering with severe depression, bipolar, schizophrenia, OCD. Then obviously they need direct initial support with the medical support. Okay. So just already the same into the graphic form. Okay. So if there is a mild, let's talk and heal, self-care, lifestyle modification. This is very important. Respect body instincts and posture, sleep, your diet. Okay, just a second. Okay, today I will give this very important tip about this lifestyle modification. Also, we'll talk soon. So moderate, we just narrate. Psychotherapy may include medication, lifestyle and social support. And if severe, then obviously medication often essential. Okay, sometimes one has to go with the intensive psychotherapy, and for this, sometime very rarely one has to go, but if required, structure support like hospitalization and other factors. Now here, self-care, and one of the very beautiful self-care what we have find, and now the society is also realizing, is meditation. So there is just a general research based impact of the meditation, because we are going to talk today about one special meditation that we are working on, and we are helping the peoples with this mental health issue with our global initiative, that is smile meditation. So in general also, with general researches, this is just a general research papers from where we have taken this reference for you to guide you. Okay, how if in the mild and moderate cases, one is making meditation a part of his routines, then it's good one to help you out by reducing anxiety and depression. Okay, even relapses of the depressions. Okay, mainly there is especially a stress hormone, which is mainly on hormonal level, which is the issue between the mind and body, this connection to disturb you. So that is also with the studies showing how this meditation, okay, now we are right now on meditation, okay, and improves workplace mental health. This is very important for all of you here. Okay, now because you are in job life, your mind is utilizing the maximum, what the best capacity you have, but still you become exhaustive, suffering, and then it affects your other three lives also. Okay. So in general, meditation has also proven his effectiveness. Okay. Parallelly, along with the supportive systems as and when required. So what we are here introducing you shortly is about the origin smile mudra healings. Okay, basically it is based on triogen smile meditation. There are worldwide number of meditations. Everyone is effective, but what Professor Park with his realization and scientific works realize the prefix of smile, and this smile, as I say, it's not a external smile. This is something what you realize from inside in a harmonious state. And with the help of this exclusive smile meditation, peoples can help this mental issues to overcome. So how this origin smile healings helps, or any meditation helps. Okay. So from journey from a psychosomatic struggle to finally inner awakening. What is commonly we need whenever we are suffering mentally? What we need at last? This is a very important question. What is our core outcome we need in our life? If I ask you here right now, what do you need your best? What is the best thing you need in your life? Which you and what you, and that belonging you want to have in the full life, whole life. You don't want to lose. Gadi, bangla, makan, pesa, okay, money, all physical belongings. Only, even in physical belongings, there is nothing wrong. You should, okay. But what you will gain after that money, when you will utilize that money, what you will get, even through that channel. Let's say this is something I have noted for all of you, which I feel you will all will agree that what is the final productivity we need? Peace. Everyone, I am, you are here. Everyone is needing peace, calmness, mindfulness. And to achieve this, sometime we have to get to the wholeness consciousness. To achieve the first three, remember, first three, peace and calmness, the mindfulness state, wholeness state, realizing true self, self awakening. This is all required. To get to the peace and calmness as a final product, one has to first achieve this pre-states. To achieve inner clarity, no confusings, freedom from overreactivity of our thoughts, of your emotions. If you want to have a compassion, also to cultivate compassion, all these three, all this mindfulness, wholesense states are just interrelated states. Resilience, whenever we fall into the life, low phases of the life, how to continue being on your own foots, resilience, all these possibilities, what we are actually daily demanding, directly, indirectly, whatever I have written, any mental health person, issues person needs finally these things at last. Even then healing, if all this are now started troubling him psychosomatically, then healing part. So all this core outcomes, insight, silence, joy, gratitude, this is all the byproducts. Number of here is byproducts. And the final product is at last is liberation from suffering, identification, and illusions. And to achieve this goal, to achieve the peace and calmness, this is all the parallel cultivating. This is all mental factors only. And to achieve this, all this, meditation is the process. Very important, you have to understand that meditation is only a process. And what is the product? Actually, these are the products. And if you get this product, then when you have an amrit, then all the good and bads will be harmonized. So all your extremes on psychosomatics, any extremes of any emotion automatically is under harmony if you have this final outcomes. So meditation is a process to cultivate all these things. So if you perform meditation into the right way, proper way, this is all your productivities, friends. So that's why any meditation in general, if we see, at least I can talk right now about the Origin Smile meditation healing system. Actually, it has to be holistic, should have an integrated approach, complete. Why this is important? Because we are no doubt dealing from the second stone from the below, mind. But mind cannot exist without being the other body, soul, and spirit. We cannot separate them. We, as a wonderful, beautiful existence, coexist like one life, which includes all these four factors. They are interrelated factors. So if you want to harmonize, to make mind to accomplish to the best, we have to care the other three factors also. That is what we say as a holistic approach, integrated approach. So meditation has this possibility because we are using the word wholenessness. So this is just a general insight about an holistic healing in worldwide systems. Why meditation is also considered as one of the holistics. That is, first you have to be aware about it. Because what are the basic features of a holistic? First thing, you are considered as a whole person. And it's interconnected with all your lives. All your life means your personal life, number 2 point here, your family life, your social life, all is in one integration to see as a whole. And even if required, along with the medicine practices, if required, other alternative and complementary. All is in beautiful combination as required. And most important here is to underline is here, to reach to the real cause, real root cause of your disease. This is very, very important. Because sometimes body diagnosis is not enough. You have to go in beyond the body, mind, and higher self inside your behavioral self, your spirit self. Okay. And whenever there is a holistic approach, and especially this Origin Smile healing has a very clinical approach. Even meditation now has a clinical approach. Your treatment is planned very exclusively. For example, 10 people of you right now are having a really stress problem or anger problem, let's say, which is really so overflowing that it is hurting you as well as your near dears, for example. Then for you, the treatment or prescription cannot be generalized, because stress is an effect of something, a root cause behind. Someone of you may be coming from the origin of the personal life, someone else having a problem from the social life, someone is coming from the family origin. So much details as possible. Someone is having problem from the financial origin, someone is having the problem with the relationships. And for being a holistic approach, we have understanding for each and everything as a separate, we say switches. points are different. Meditation, different. Even the tools, what we are going to see soon right now, introduced, that is mudras, just by touching some points, it is evolved system that even for every 10 cases of stress, the applications will be different because we are individually different. So that exclusiveness, what we see as personalized healing. And then finally, long term, any best healing is which makes you to to make you understand how to self care is the best care, along with the help of doctors when needed. But finally, self care and empowering. And by understanding the whole scenario, then you can take a proper prevention also. And then achieving the highest goal, that is the evolve and transform your need. Because we as a human being are not born here to suffer. We are born here to smilize, harmonize. We are the most evolved human being and the blessed what we are blessed here. And with this, okay, so this origin smile mudra meditation actually composed of some tools like mudras, smile, we say triogen smile mudras, breath. These are the various tools to activate the meditation process. And this is what the product we just checked. So this is how, and as I reflect on you, we work on a very personalized meditation for all these issues. So like for example, few of the root causes of suffering, sometimes we don't consider, but this is the possible layers for you. It's very interesting to see the second layer, that is intention layer. Sometimes your wrong intention is the root cause of your all the mental sufferings. Always bad intentions for someone, this also we all know, okay, it suffers us. But sometimes too good intention, okay. For example, you will understand what is too good intention. We have, everyone of us want to succeed in the life. We all have our success definition different for every being. But sometimes we want to say, I only want to success. Only I don't mind others. Even to accomplish my goal, if I have to make someone to deceive, is okay. This is what we say good intention. It is selfish oriented only self. He's not having a neutral means neutral is as a wholesome, only living for self. Someone is living, earning, want to earn the money only for self. And he says, though he has a family life, and he has that ego to say inside that this is my money and I am feeding my family. So my family is dependent on me. He don't recognize the family contribution, and sometimes see from anger to them or low to them. He's not making them to give them equal smile space. So all this just to reflect on good intention. Human sometimes is not aware that his all selfish intentions is also over expectation. Then sometimes over expectation from the self. On the contrary, over expectation from the others is also problem, which comes from the other lives. So this is just sometimes to understand, even our intention becomes the cause of our issues, mental health issues. And that is the nidus which constantly hurts you. Someone has spoken a wrong word to you 10 years back, and still you feel hurted. And still from 10 years, you still recall that voice, his face, that scenario, constantly brooding. You're not able to move on. You're stuck. Why? Because you because of your mind is not understanding in the my smile capacity something. So these are the few factors just I'm telling you because we are short of time, but just you can see even the most important for you to understand lifestyle, stress, as I say, anything extreme, even your food, even your postures, even your environment. So on the food, definitely I'm going to give you the tip today before we leave. Okay. So all this has to be considered as a possible causes. And if someone works on all these factors consciously, awarely, meditation is a way to be aware about all these possibilities and to utilize them for your self-care. Then productivity of calm, peace is by default. System is already existing with all those peace and calmness. Only you don't know how to cultivate it. It's already there. The potential is there. So the important factor is to root out those causes. And we have a system that with the detailed history, we come to the cause of a person and we root out that and we make the person to go into the meditative state. So here smile is also seems to be like a mudra gesture, but actually it is come from inside. So the process of smile meditation when really goes inside, then it activates that conscious inner core smiles. So that becomes a transformative. We have system of mantras, sounds, even breathe. Okay, so these are okay. Because of some issue, I want to show you some testimonials. But anyway, okay, you can find those testimonials by visiting to our websites. Okay, but okay, so just to show you how peoples are already finding this approach. So commonly, any holistic approach of meditation takes care about this part, being your exclusivity and to come to the real cause of your mental issues. And with the correct cause, then it makes the proper process to understand. So at least I'm right now talking about our origin smiling process. So by a proper consultation, then we have a customized clinical mudras. So because some of you may be aware about the mudra system, but this is very well now researched and developed by me. Okay, under the philosophy of Professor Park. Okay, now we have a even clinic mudra clinics. Okay, when you go to the medicine doctor, you know that when you come from that clinic out, you will have the medicine prescription. Though I'm a homeopathic medical doctor also. So when you go to the homeopathic medical doctor, you are sure that you will get that homeopathic pills. When you go to the Ayurvedic doctor with the same, let's say, mental stress, you will have the Ayurvedic drug. And when you will go to this mudra clinic, okay, you will be given a mudra and meditation, guided meditation on the spot as well as for your self practice. This is how so it is customized. That is to be seen of. And then personalized, even meditations are given in a personalized form. And as I say, added tools like food, other things are also part of this systems. Even this is a modality, sometimes relate with acupuncture, acupressure. Okay, yogas, gymnastic is also part of it. Okay, and then okay, so some process we follow, there's a treatment plan. Okay, just to see a look on this. Okay, commonly 3-4 sessions are good enough for you to understand your diagnosis, your self-care, your self-practice is encouraged here, so that you started doing the things on your own self anyway. So this is how our Origin Smile Foundation is working in this system under the Professor Park knowledge and guidance. Okay, okay, okay. So before I take the questions, as I committed you, I will give you some tips. Okay, I will just remove it. Okay.
Thank you very much, Dr. Jain, for this
Okay.
session. I have few questions which were received during the registration process.
Ji.
So would like to take that and look forward for yours. See, some of it you would have covered in both the sessions. I'm taking the questions for both the sessions together. But
Okay.
more like a sum up would really help.
Yes, yes. Okay,
So
so Priya ji, I just, and I should not forget, as I'm committing, I will give you some tips. Okay.
yeah,
Okay. Okay. Because how to start. Okay, I will take the question. Let me just, I will take 2 minutes more.
okay.
Okay. Anna. So the first meditation start from the body, yourself. Respect the body. Even if you want to harmonize your mind, respect your body first. Respecting the body and followed with the family also. Then, okay. So how to just simply respect? You will find that even your mind also evolve into the meditative state. Even without practicing the meditation and mudras, this is what I'm here to inform you. So whenever in a whole day you want to eat anything or drink anything, whenever, just respect the body which is originally designed. Sit down, and then eat. Even if you want to take a half glass of water, a sip of water, what is the ideal posture? What nature has decided? Respect. Body needs to be on the sitting posture. And then take the food or drink a sip of water. Even doesn't matter, 10 times you have to do the job, you have to. Even sometimes while play, sometimes you have some crunches, munches, even a small munch. Don't try, conscious, practice, sit down wherever you are and then have it. Even the more ideal way that you should, when you're eating, you should eat silently. We say in Hindi, Maun Vrat. Okay. I'm not giving you any vrat right now, but it has a very great meaning. While while eating, if you're watching the mobile, I know this has been told by a number of people, by family, but not to do it. I'm giving you a very, very scientific version and very, very productive style. You just try this for a month, at least from now, today. While eating anything, taking food, mouth, any origin, anything, don't watch anything. Because all the mind engagements, these are all mind engagements. During the eating time, drinking time, you are actually disrespecting the body. Please take my words very strongly. You are disrespecting. As mind is saying, I don't mind body. As your mind is saying, I am the owner of this myself. I don't need body. This ignorance in your lifestyles is one of the major. And you know how much real time it takes you to practice this in a day? What I'm saying? If you just calculate how much time you are spending in 24 hours or minutes, if you multiply by minutes, hardly, hardly, let's say half an hour, or let's say 60 minutes, all dinner, everything. So let's take, okay, 1 hour, 30 minutes. This much respect to the body, if you give, and let's see how body respects you then. And it will support your mind parallelly. This will help your mind also to be remain in a passive and calmer state. Even those who are able to do one more possibility in this respect of mind to body, that after eating also, don't immediately sleep. Ideally, when you eat something, to get it digested to the stomach level, it takes about 1.5 hours, ideally to 2 hours. Because lying posture is not designed for eating. So even to get it minimum digested, minimum 1 to 2 hours means even in the night time, if you're taking a little bit food, better take 1.5 hours before, and then before you go to sleep. Better sunrise, sunset. Okay. Okay. But anyway, I know you are in a different conditions outside, at least that much, that immediately don't lie after eating. This much, 4 things, friends. If you do, this is your body meditation itself. And this is the basic practice. If you practice, you will remember number of things are changing in you only by this much. And this is a very, very general practice. Rest, lot many things we have done to perform some conscious practice with the help of mudras and other things. That's a different. Okay. So, okay. Thank you, Priyaji. Now I am ready to take the questions.
Great. So here are some questions which we've received from the participants. Maybe if you can, even if they've been covered in the past 2 days, I mean, the last session for this session, maybe if you can help sum up them so that it'll be easier. So the first question is from Mr. Rajendra. It says, what are some early warning signs that someone may be struggling with their mental health? How can we tell if a mental health diagnosis is accurate? And what should you do if you are unsure? What are the key signs that it's time to seek professional help?
Okay, so Rajanji, I think today we very well take care of this part. Okay, and maybe I think his question is taken care. Okay, so in short, Anna, if any of your feelings, whatsoever it may be, your thoughts or your behaviors started troubling yourself or other self in the routine life, that is just, and it becomes a routine feature, then this is just in general understanding that yes, now you should look forward to do something for it. Otherwise, if we have feelings, thoughts coming plus minus, but it is you're able to pass on them easily, it is not making it to carry forward next day, next day. If there is no carry forward, then it is all is fine. But if not, it is getting carried forward, then yes, we have to see. Okay, rest you can see in more detail today in our webinar. I think you got your answers. Yes. Okay,
great. Mr. Sridhar's question was, what is the difference between mental and emotional health? What is depression and how can I tell if I'm experiencing it?
Okay, Sridharji. See, mental, commonly we relate with the thoughts, memories. Okay, what we say as thinking part. And emotions like fear, joy, gratitude, love. Love is a commonly, love is good word, but sometimes now this love is also, if not in harmony, in optimized level, it bounds you. A beautiful gift by the creator. Sometimes because of our ignorance, we are not utilizing that love in a very harmonious, conscious manner. So sometimes that emotions also suffer. So like love, gratitude, okay, fears, as I say. So there is actually 22 emotions, we say, group of emotions. So commonly, emotions are commonly expressive in our routine days, which sometimes even expressed through your, one person is silent, but his emotions expressed through his body face value. Okay. So sadness, weeping, So there is a fundamentally, yes, there is a difference between emotion and mental. So commonly commonly, as I say, thinking, negative thinking, as I have taken today some words for you, intentions, which is it is going all in your inside. I know your spirit about thinking something always negative about someone or self. This is all come from the mental, which is a silent part. So there is non-expressive part of your mental activity, and one is expressive. Expressive is emotional, and non-expressive is mental. But both are both are part of the same boat, like a seesaw. So if the emotional something changing, mental is trying to harmonize it or complement it, and then if they are okay together, otherwise they also get worse properly. So anyway, this is like a seesaw. Okay, and but there is a very clear difference to see. So commonly the depression commonly is a combination for you to understand where both corners of your mental part, that is emotional health as well as mental health, both are in trouble. So both are started affecting. So that is what we say something as a depression. And sadness is one of the emotional part, and overthinking is also there in the depression. Or even sometimes depression opposite is also there, no thinking at all. Someone you are asked with this very chronic depression people, you ask what is a purpose, what you are doing here, why you are here, why you are doing this, I don't know. They don't know anything. They don't have any thought also, even required thought. So this is how you can understand. Okay, next please.
The next question is from a person called Tamirar. Lack of knowledge to approach psychiatrists. How to find them? Maybe scared of consulting fee and other expenses. Due to this, people may stop themselves to approach psychiatrists. Please advise.
Okay. Okay, because I think now, because the best possibility with the psychiatrist part is nowadays, now we are not limited to our local city for consultation, because to consult a psychiatrist now you can go online. Even if you get a references in other cities who have already experienced them as a good psychiatrist, the beauty is that you can even consult them, because the main thumb rule in a psychiatrist also is a correct diagnosis and how they, because psychiatrist part is not only including the medicine. We have to understand, friend, it's a counseling also, because counseling is parallel along with the medication if required. So any counselor who is really a better counselor and understanding about your real cause, real factors, and how to really work on them with your self practice more, that also is very, very equally important. Okay. So uh, obviously that there's no fixed online system to tell you even, okay, this is the best one. Only by experiences, and I think this is only you have to find your ways. Okay. And okay, regarding consulting fees and other things, okay, I think I'm much to comment
Yeah,
on it. Okay.
no problem. The
Okay.
next question is from Mr. Deepak. He has asked, how can one open up or help someone else to open up about their mental health, as people tend to take it in a fun way rather than being serious about it?
Perfect, Deepaji. I know. So I understand, because to really find a real friend in your life who really understand you, because friendship is the best relationship, a best quality of relationship within all the relationship. So that best friend you have to find, and that best friend can be your wife, for example, if you're married, can be your child who is grown up. Okay, can be your mother, can be your father, can be anyone. Or even if you don't have that space, then yes, your any healer or any psychiatrist or any doctor who is dealing with it, this is the right place for you to share. But sharing is must, communication is well. And the beautiful thing is, It's not like a body science, it's like a mental science. And in the mental science, the most important is the trust with the compassion, with the understanding, so that friendship qualities are very much, and at the above all, trust. Because to whom you share, he really want to have a solution for you. Okay, so not to unnecessarily even to share your problem, unnecessarily also to those who are not enough for you. Okay, sometimes we cannot define initially. We try, everyone tries, but sometimes we feel that okay, things are not coming in a very harmony way, a productive way. So better look forward to the next to find a best friend. And we all have, okay.
Great. So the next question is from Preeti. She asks how to have stable mental health with ongoing hectic office schedule.
Good. So the first of all, we cannot avoid the hectic office schedule. Okay. Yes, something we cannot avoid, the scenarios around us. Okay, so now here comes that if you have a 10 works to do in a whole day life, starting from your personal priorities in a day, including your job priorities, even in the job 10 priorities, and then parallelly with the family, and if you have a social responsibilities also some occasionally. So human mind is already designed in such a way that he can perform multiple tasks at a time. He can at least think on it, he can have an overview on it. So mind has a capacity to be on the one moment 10 places. Your body can remain only at one moment, one place only. Your body has a limitation, but mind, at this moment right now you are with me with the lecture, but see how right now you're thinking lot many things around you. You can even you can think about the sun and moon and going to the Mars right now also. Okay, so 10 things simultaneously we can have. The most important is that out of this possibilities, potential of your mind, priority wise, you are able to focus on a moment of time whenever desired to accomplish it, along with it giving to the other priority. So all this bifurcation, prioritizing, and that is what I'm saying, management part as a whole, and then going effectively is also one of the possibility of your human mind only. That is what we say as conscious mind, aware mind, mindful state mind, and that is what we say as evolved mind and smile mind. If we are able to have this states in our mindset, then along with all the hectic schedules also, you are able to manage all those things in a priority wise, and you can take care well. Means your, if hectic job is a part of your routine and you have to be, there is no choice to be free from the office, you have to be into the boat, and then finally you have to drive also, then increase your mental capacities. I'm using the word very clear, understand mental capacities. And capacity is not only thinking 10 things more. Whatever you have, how to manage them in a very conscious, peaceful, calmness, peace, the same factor what I just said as a product. With the same productivity, final calmness, peace, and you're managing life. This is all possible through meditation things, for example. Okay. Okay.
Great. So Puneetji has asked, what are the different suggested remedies to maintain peaceful mental health? Some of them you've already answered. I just go to the third part of the question, which is how to synchronize between professional, social, and family obligations.
Okay. So my answer is still only we have to make, because if this all responsibilities are responsibilities, okay, which is natural, obvious, that you cannot cut down, at least what is really real responsibilities, because there are sometimes unreal responsibilities also. Sometimes where we are not desired, we are there. That is also a problem with the human. So I am talking about the real priorities you have to perform in your professional, social, family obligations, which are really an obligations. Then only thing is you need a better aware, conscious state. Okay. Meditative state is just a process to help you to be into that state. So actually the synchronization is natural also. I am saying it is as natural as, and I'll take this, my understanding very simply, Punitji. Right now, you know, it's wondrous. Your brain is also working. Your heart is also working. Your lungs is also working. Your every organ is working. And even now, with the help of science, you are also aware that you are not made up of the organs. At last, you are finally made up of the single cells, and you have trillions and trillions of cells. And you know, every cell is working right now perfectly on his work. And beauty is all are working in the synchronicity as a whole. No one is going out of the box. Even your brain is not directly controlling the single cell of your kidney, but still the kidney cell knows what I have to do my job here locally. Your partial is controlled only from the brain origin. You're not 24 hourly about after taking the food. Are you thinking, oh, digest, stomach, please do this job, large intestine, now your job. Okay, after 2 hours, now this hormone, please release. Are you instructing everything daily? Like how you're instructing in your job profile? No. The beauty is all are working together in integration as a whole. There is a beautiful synchronization system which we can see the system creator has created. Only thing is, if you see from this, the same way I'm trying to tell you, that professional social life, if we are being in the human life, we are bound to pass through all these bridges of personal life, family life, all has to be there. If creator system, then there has to be a system of synchronization already exists. Only you should upgrade yourself. And if we upgrade consciously, we can utilize this. So this is how I just want to say. Possibility and potential you can see from the nature. Okay, Puniji?
Great.
Okay.
Uh,
So smile, meditate is the answer. Okay. Okay.
So Deepak's question is, how does our culture and societal expectations influence our understanding and expression of emotions and mental health needs?
Yes, very important question, Deepak ji. Because somewhere human mind, okay, if unaware human mind, a low conscious human being, sometimes is low moral also, low morality. Now here the morality is not only about your behaviors, your talks. Okay. What I am just trying to make you understand, that your personal life, you have a personal life. Deepak ji, your wife also has her personal life. He's a personal individual. Your child also is an individual self. Though you are together living in one family mind, but all have their individual self-respect. But being in together, we have our one another mind. We say family mind. So what the morality says, that I should respect everyone's individual also. Though we as a one family, lot many things we can share each other. But there is something, sometimes we don't share. Deepak ji will not like to share her job profile issues, her job stress to bring to the family. That emotions exit is at the family. This is immorality, because you are crossing the barriers. So this is the disrespect about the barriers which is nature has created. If one respects this, the same thing is coming to your cultural and social expectations. Right now, we are everywhere. We are now with the help, with the wonderful medias. Now politics is around us. Okay, the countries, all politics, we are now understanding. And we have a cultural differences, religion differences. Every day, lot many information, misinformation is coming and is shooting from all the corners. And we can see the human is how is suffering nowadays. Having a disharmony feeling about any one religion or a culture or a country, and even thinking negative about them constantly 24 hours. I think you're getting my point. Non-smiling, we are not in the peace and harmony feeling. So all these factors, though we are in interrelated, but sometimes what I'm just trying to get to the things, Deepak ji, sometimes we are making those things to come to our house, family life and personal life. Cultural is cultural, keep it there, you be there. Don't make that thoughts and emotions related to come to your boundary inside the family. Number of people, because of this all the present scenarios, sometimes they are struggling in their family relationship, and they're, oh, my job, I'm not able to do my work. Why? Because today my party loses. My party loses. You are not a politician. You don't lose, your party lose. For example, to say, my point is that we are not maintaining. So we are socially concerned, we have to be into that concern. Sometimes we don't need to be on the front to execute the duty. Our prime minister is there, for example, to do some job. His job is to work on that level of country level. Let him do his job. Sometimes only we can support, consciously support. We can smile on them, we can bless them, correct or not? Sometimes we are not required to be there physically, but sometimes we are just over, beyond crossing the limits. So I think you are getting my essence to say a human conscious self is very well creating, maintaining the morality between personal life. इसको दहलीज कहते हैं हम लोग, थ्रेशोल्ड कहते हैं, दहलीजें कहते हैं. आप तीनों की दहलीजों को रिस्पेक्ट करिए. तीनों दहलीजें साथ में हैं. All the three should remain together, but in a harmony and integration. Okay, so I think it will give you a sense what I mean to say.
Right, sir. So the next question is from Jyoti. If we have habit of thinking too much, what can be done? What can be done?
Okay, Jyoti ji, smile, meditate, I can say. Why I'm saying this? Okay, because you cannot stop thinking. Thinking is your mind activity. Only thing is, if thinking is not into the proper direction, not streamlined, then thinking will be troublesome for you. But otherwise, the thinking is a feed of a scientist. Thinking is a feed of a creative person. Thinking is a feed of one who is making the development and the growth in his mind. Okay, so how you can say no mind? You need a mind. You need a thinking. Only that thinking has to be streamlined. When I say streamlined, means harmony, to the purpose, to the goal. Okay, so all these possibilities, a conscious mind, a conscious aware person can have it. You can see the picture on my back. Professor Park and beyond is Buddha. It's just his spirit is just an indication for us. All his teachings is, for example, okay, he also he has given all the lectures and sermons on every part of the life, whatever we are right now discussing, correct or not? Personal, family, everything. Okay, all under the light of awakening, self-awakening, self-spirit. So same Professor Park, what we are working on the smile meditation is with the same spirit, same light. This is what is the possibilities for all of us. Okay.
All right. Thank you very much, Dr. Jain. I've not received any further questions on the Q&A box. These are from the registrations where people had shared. The 2 day session were very enlightening and a lot of information for us to take back home and work on. I just want to thank once again the team of NISA the DCBA, the NCBA, and of course the entire AMTOI team who has been behind in organizing this. I hope the participants found good, good benefit out of the whole session. Over to Harish Bhai. You're on mute, sir.
Sorry. Okay. Good afternoon again. And yeah, this is the end of the second session. And I I would like to say that, what Dr. Jain has been mentioning, we need to acknowledge, we need to understand, and we need to know these symptoms, and at the same time, do not diagnose yourself. There are professionals who will do that for you. It is like, I'm just putting it in simple words. After a long period of time, you realize that if I get a cold and I get a cough and I get a chest congestion, that I have to go to a doctor. So those are the symptoms that takes you to a doctor. So what Dr. Jain has explained is that these are the symptoms. That does not mean that you have become expert in diagnosing yourself. This is just to tell you that such things exist. And when you say it's mental health, that means, you are looking at it like your own body. So the more take care you take of your body, the better results you get from it. So people exercise, people do. So you have to give yourself time. You have to give yourself, the respect. You also have to respect yourself to understand, what this is all about. At least this is what I understood. And if I am wrong, Dr. Jain can always correct me, but I'm just saying that, this is what we should look at. Let us not go back as experts. Let's go back as that we've learned something, and we've learned how to understand what it is. And there was one question where one person said that, how do you help? So, like doctor said, you have to search for a good friend. At least decide that people who are over here, you will be one good friend to somebody who has these problems. Let's look at it that way. So at least, we go back saying that, oh, yes, we will be a good friend. We will listen and not look at that person and say, oh, he's mad. No, listen to that person, be a good friend is the lesson that I am taking back. And I respect that everyone takes it back also.
Absolutely
Thank you
well.
so much.
Thank you.
Thank you.
Thank you, everyone. I hope you had a great time. Thank you very much, Dr. Pankaj, for taking out time 2 days and helping us with this lovely session.
Thank you. Thank you very much.
Thank you. Neha, you can stop the recording.